many schools all over Europe and in some schools in the States too. A combined face-bow stylus registration technique based on Alfred Gysi's work was developed by Albert Gerber and is being used at the Dental Institute at the University of Zurich. The combined face-bow stylus registration technique has been found valuable in prosthodontic treatment and in occlusal analysis. It has been improved in everyday practice as a method that furnishes precise data. It is easy to work with, and it can therefore be accepted as a highly rationalized way to comprehensive dentistry. The transfer of data from the patient on an articulator provides the opportunity to study on mounted casts the functional relation of antagonistic teeth even from an intraoral side in a more precise and detailed view. Prosthodontic reconstruction built in an articulator adjusted to the patient's data afford a harmonious function with a minimum necessity of adjustment after insertion of the reconstruction in the patient's mouth. The purpose of the combined face-bow stylus registration technique are: 1. To determine centric jaw relation, 2. To trace and measure the condylar path in protrusive movement, and 3. To mount the stone cast in a proper relationship on an articulator. Point 1. Centric relation, as we define it, is the position of the mandible to the maxilla, characterized by a centered position of the condyle in his fossa, that is, the uppermost and midmost position of the condyles in their glenoid fossa, without compression or distraction of the surrounding structures. To determine centric relation as just defined, the intraoral Gothic arch tracing has proven to be a reliable and relatively simple procedure. The apex of the Gothic arch represents, under normal physiologic conditions, a reproducible border position of the mandible from which lateral movements can be made. The tripod arrangement of the intraoral registration device, here mounted on an edentulous patient, guides the mandible almost automatically into the centric relation. One pod is the centric bearing pin. The two other pods are the condyles, as shown in this figure. Since neurophysiological investigations hint at the fact that there are many horizontal positions which the mandible can assume within normal functional range, a tolerable occlusion is rather indicated than a pinpoint one. This freedom of movement in centric, in harmony with the temporomandibular joint in the neuromuscular system, avoids undue stress upon supporting tissue rather than an occlusal confined to strictly guided path. Point 2. The condylar path for protrusive movements of the mandible can be registered easily, quickly and precisely without distortion. It can be measured in degrees as related to the plane of occlusion. Point 3. The face-bow transfer allows a correct mounting of the casts on an articulator, relating the mandibular cast to the transverse axis of the articulator, which can